Welcome back to Market Headlines. It is finally fixed. Government has set the price for the Gotong Royong vaccine used in private vaccinations program. It is worth 325,000 for a dose. Meanwhile, maximum service tariff is 177,000 a dose. Indonesia uses Chinese-sourced COVID-19 vaccine Sinopharm for private vaccination program, which Food and Drugs Monitoring Agency has officially issued an emergency use authorization for the vaccine. It is worth 321,000 for a dose. Meanwhile, maximum service tariff is 177,000 a dose. The purchase price of vaccine is the highest price of vaccine dose purchased by a legal entity, business entity, including 20% profit margin and distribution cost, but does not include value-added tax. The financing of Gotong Royong vaccinations is regulated through the appointment of biopharma, whereas the regulations have been stipulated by the decree of the Ministry of Health concerning the appointment of biopharma in the implementations of the procurement of the COVID-19 vaccine. From all sources, IDX Channel. In a bid to accelerate and expand the coverage of COVID-19 vaccination in order to achieve immunity faster, the government has launched the implementations of Gotong Royong COVID-19 vaccination. So in short, the government opens opportunities for private sector to participate in vaccination program. The private scheme is known as Gotong Royong vaccination. But because the vaccinations is administered by private sectors, many people wonder how much it will cost. Just a week before, government has stated that a fixed price has been set. So let's see how much it cost in the next graphic. Through the next graphic, we can see that the purchase price is 321,000 for a dose. Meanwhile, for the maximum rate of the vaccination service, reach 117,000 for a dose. So let's do the calculations here. The total will be 500,000 rupiah for a dose. And it must be taken in 2 doses, so it will cost around 1 million rupiah. While the purchase price, which is 321,000 rupiah, is the highest price purchased by legal entity or business entity, including 20% margin and also distribution cost. But it does not include the value-added tax. Same with the service fee. The maximum tariff of 117,000 rupiah is the highest tariff a dose. This has included a 15% margin, but it doesn't include the value-added tax. And compared to the vaccination program, which is fully funded by the government, of course, the price of these vaccines is much more expensive. Private vaccinations starting today, Monday, backwards from that was planned by May 9. And the type of vaccine starts with the Sinopharm vaccine. There's a plan for a CanSino vaccine too, but for now, Sinopharm inoculates first. So let's see what Sinopharm vaccines is all about in the next graphic. Through the next graphic, we can know that the emergency use authorizations of this Sinopharm vaccine was issued at April 29, 2021. And then it has been over 982,400 doses has arrived in Indonesia. And the procurement contract consists of 7.5 million doses. Meanwhile, it seeks to inoculate 181.5 million people by January 2022. And the fact is that after Sinovac Biotech and AstraZeneca, Sinopharm is the third company to have its vaccine approved by Indonesia. The vaccine is seeking to inoculate 181.5 million people by January 2022. And the procedure is like average vaccine, whereas it is divided into 2 shots. And for the procurement of the vaccine itself, the government has entered into the contract to procure the Sinopharm vaccines of 7.5 million doses, with a number of vaccines available as much as 500,000 doses. And regarding its safety, here it is. The Sinopharm vaccine has been declared safe for use. The statement was announced by the Food and Drug Supervisory Agency since April 29, 2021, and the Sinopharm vaccine has received halal certifications from Indonesian Ulama Council or MUI. We can measure an effective vaccine through the efficacy rate. So let's see Sinopharm efficacy rate in the next graphic. Here it is. We can see the efficacy rate of this Sinopharm vaccines. While it was stated by Beijing Biological Products Institute, the efficacy rate can reach 79.34%. Meanwhile, from the Global Times, the UAA3 clinical test, it reached 78%. Panelo Kito, as the chief of Indonesia's Food and Drug Agency, say that Sinopharm vaccine recipients has reported higher antibody rates and rare side effects, such as swelling or diarrhea. But then no detailed efficacy data of Sinopharm's vaccine has been publicly released. But however, its developer, as I said before, Beijing Biological Products Institute, a unit of Sinopharm subsidiary China and National Biotech Group, has said that vaccine was 79.34% effective in preventing people from developing the disease. And seeing that it is safe to use and more people demand to be vaccinated, enthusiasm of the companies in Indonesia to enroll their workers into the Gotong Royong vaccinations program is enormous. So let's see how many registrants are there in the next graphic. Through the data from Kadin, we can see that there are 17,832 companies, and then for the recipients itself, it reached 8,665,363 recipients. So this is the registrants of the Gotong Royong vaccine program. And while through the data, we can see that the enthusiasm of the companies in Indonesia to enroll the workers into Gotong Royong vaccinations program is very enormous. The registrations will be open until May 20, 2021, and the vaccination itself will be carried out in stages by taking into account the zone where the company is located and the type of the sector. So if one of you own the company and want to vaccinate your workers, still there is time, but sooner the better. And yes, viewers, we hope that the private vaccinations program, which starts today, could back up the government and to reach the herd immunity. Because our goal is to ensure the vaccine protects against this dreadful disease, whatever it throws at us, to keep us safe. And stay with us because market headlines will be right back after this quick break.